This is a state-of-the-art laparoscopic or keyhole surgery theatre, because what it allows us to do is to see exactly what's happening inside your body in high definition on television screens, 4 different television screens angled at different parts of your body. The procedures that I perform here are operations designed to remove the gallbladder, to repair hernias, and for bowel cancer surgery. And all of these are done through keyhole surgery. There's green lighting. And the reason for this is this allows us to avoid glare, but also provides a comfortable light for people to operate and work around the operating theatre without distracting the surgeon. The gallbladder operation usually takes between half an hour and an hour and a half. On the day of the operation, I will visit a patient prior to the surgery. I'll explain the surgery in great detail. The operation to remove a gallbladder will involve the patient lying flat on the table, various different instruments which are inserted inside the body through tiny ports. What we will first do is we will have to insert carbon dioxide inside the abdominal cavity. And what that will do is that will create a space in order to operate above the bowel. To do that, an incision is made around the belly button, which is approximately about 1 centimetre in diameter, and then a tiny tube is placed through that and gas is instilled through that tube. 2 to 3 further incisions are made on the skin of the abdomen, and this allows us access to put instruments inside the abdomen in order to operate and remove the gallbladder. And these are the instruments that we use during the gallbladder surgery. The first is what's called a laparoscope, and this is a camera that's fitted on the end with a light cable attached. And then what happens is you can see that I'm looking at the anaesthetic equipment because it's beautifully transmitted on a high definition screen. These are instruments that we insert through the ports inside the abdominal cavity. The first is a grasper, and as you can see, it's very long, which allows us to operate on the outside of the body, but yet to operate at the same time on the inside. At the end, you can see there's a grasper which grabs the gallbladder. This is scissors. We have to cut various different things. The scissors are very tiny, but extremely sharp. The gallbladder is removed through one of the ports once it's been separated from what's called the bile ducts. And once the gallbladder and the gallstones are removed through one of the abdominal incisions, all the incisions are closed with absorbable stitches, which means that you don't have to have any stitches removed. Immediately after surgery, the patient goes into recovery, and once they've fully recovered and are awake and are breathing well and their observations are stable, they then are taken via a trolley to their room. They will feel bloated and sometimes get a bit of shoulder tip pain because the gas that we put into the abdomen in order to operate stays within the abdomen for at least 24 to 48 hours, and it slowly gets absorbed. So sometimes the patient can feel bloated and quite uncomfortable. However, this settles down completely. Patients normally stay in hospital for 24 hours, and I will see them following their surgery just to explain what I've done and to explain how the operation went. I would then see them the following day just to check to make sure that they're fine, check the wounds, and if they're well and they're eating and drinking and walking around, they're usually able to go home the next day. When the patient's gone home, they'll usually be able to have some painkillers to control the pain, be able to allow to eat and drink, and would take approximately about a couple of weeks off work just to fully recover. I will routinely see the patient in 4 to 6 weeks' time in my clinic. However, if there are any problems beforehand in the interim, I'd be absolutely delighted to speak to them over the telephone or can see them at an earlier appointment. Patients are usually very delighted to have this surgery because what it means is they can return to a normal life without the pain, and they can eat every single day and not have to worry.